Hey, I'm Chilla. I'm 43 years old, and in January of this year, less than 6 months ago, I donated one of my kidneys to a complete and total stranger. I was what you call a non-directed donor. I signed up to donate my kidney without having a specific person in mind, and I actually did not meet her till after the surgery. I did know a little bit about her. I knew she had a very unique medical situation and needed a kidney, and that was enough for me to agree to it, and we were a perfect match. I didn't think much about kidney disease until I was in this process to see if I qualified to become a living donor. Through the qualification process, through preparing for the surgery, through talking to other living donors, I realized that kidney disease affects so many people, even if it's not yourself that has the kidney trouble. I can't tell you how many people I've run into who know someone with kidney issues, who needs a kidney, who received a kidney. I was at my dentist the other day getting a cleaning, and they said, "Do you have any changes in your medical history?" And I said, "Actually, I do. I donated a kidney." Turns out my dentist was a kidney recipient. It's amazing. So many people's lives are affected by this disease. I met the recipient of my kidney 2 days after the surgery. Knew a little bit about her history, but didn't know her, didn't know who exactly it was going to. And when I found out everything that she had been through, I was grateful. I was so grateful that I could help her. I was so grateful that I just had the chance to change her life. And it didn't matter she was a stranger. It didn't matter where she came from. It mattered that I had an opportunity to help her. And that's what meant a lot to me. And I mean, as you can tell, I get emotional thinking about the day we met. I mean, we were just both bawling. She went on to explain all the dialysis she had been through, all the different things, and she was grateful too. So it was a win-win situation. But it was really a life-changing experience. When I learned about kidney failure and the treatments that these patients go through, I was saddened, I was humbled, I was amazed. The treatments are just so long and continuous, and every kidney warrior that I have encountered, whether it's through other people discussing it, are amazing fighters. But again, if you have the opportunity to help someone, it's an amazing, amazing experience. I ultimately decided to donate my kidney because I was given a chance to donate it. I was healthy enough to donate it. My family was supported enough to help me through this process. And there was something in my heart that I knew this had to be done. And I had to give someone else a chance at health and happiness and just days with their family, love with their family, and not feeling terrible and sick. And if you have that gift inside of you and you don't need it and you can heal and move on and live a perfectly healthy, normal life with one kidney, why would you not give that gift to somebody else? I did. My husband was most worried about my life after donating, about living with one kidney and what that meant. Does that endanger me? Does that leave me open to having kidney failure and then not having a backup? What would happen if I needed a kidney? And the team at the hospital did a great job educating both myself and him what the risks were. I was assessed from head to toe, and it showed that I could lead a perfectly healthy life with one kidney left, that the risk of failure was slim, keeping a healthy lifestyle moving forward. And my children weren't really worried. They had a few questions here and there, but other than that, I explained to them I was doing this, and even though they were older, they were teenagers, they thought the process was pretty neat, that one could do this and live a perfectly healthy life. The most stressful, hardest part for me in the process was during the evaluation. It did take a little bit longer for the hospital to evaluate whether I was a good candidate. Once they determined which kidney I would donate, and it would have to stay local for certain medical reasons. The other stressful part was not knowing who it was going to. So I did have 2 other possible recipients that fell through for one reason or another. And so the recipient who I ended up donating to was actually a 3rd possibility. So that was a little bit, that was, I would say, the most stressful part to me. The other thing that I worried about the most was not donating. I never wavered on that decision. I was most worried about the recovery, about what I had to look forward to, and how I would recover, how I would feel. But I talked to many other living donors, and that definitely helped me get through the fears and know that I have a good supportive system in place and we would get through my recovery. As I was being rolled into the operating room, of course I was nervous. It was a major surgery. Again, I was more nervous about the recovery and the after, but I was also extremely nervous for the recipient. I didn't know her. I didn't know what was going to happen, but for whatever reason, I was just so nervous for her, and I just hoped that everything would go well on her side as well as my side. The best moment after my surgery was being rolled out of the recovery room down the hallway to my hospital room, and at the end of the hallway was my family waiting for me. And just seeing them and seeing my kids' faces and seeing how happy they were, and they were like, "Yeah, Mom." That was definitely the best part of the surgery day. And then the same day, the best part was the doctor coming in and telling me that the recipient was doing amazing and passing, I don't know how many cc's of urine, and I had no idea what that meant. I said, "Is that good? Is that good?" And they said, "Oh my God, that's amazing. She's passing however many cc's of urine." So cheering for pee is always an exciting thing when you donate your kidney, apparently. So I spent 2 nights in the hospital overnight. I would say the first 7 days from the surgery was the worst, was the roughest. I did take most of the medicine that the doctors prescribed me, and I say most only because I didn't take the extra heavy painkillers, but I did take Tylenol and some of the other anti-inflammatory they gave me. The first 7 days was the worst. Very grateful I had family that could help me and stay with me and keep an eye on me. But I did take 4 weeks off of work total. By the second and third week, I still had low energy levels, rested, lots and lots of rest. But by week 3, I started feeling better. And week 4, I went back to work. What I learned about myself the most through this journey is how grateful you can feel to help someone, to be given the chance to help someone, how grateful I am to have seen my family come together and support me on this. And some people's reactions, it's been amazing to see how people get touched by your actions and your decisions. So that's been also an amazing opportunity and insight to this process. After donating my kidney, my health has not changed one bit that I can feel. I have a couple of awesome scars. They're still a little bit sensitive. It's been less than 6 months, but that's nothing unusual. As far as health-wise, the only thing I can't do is ever take Advil again. They'll tell you that, but that never bothered me, and that still doesn't bother me. Other than that, I have a appreciation for life. Again, with this being less than 6 months away, every time I have a bad day or a stressful day at work, I think about the process. I think about the feelings that I went through doing this. I think about meeting my recipient and those amazing, grateful thoughts that come back to me, and the world, everything else melts away. It puts life into perspective. It puts your world into perspective, and for me, it made me a much more grateful human being. Something I didn't expect during this journey was people's reactions to me donating a kidney. I didn't tell a lot of people while I was going through the process of being evaluated. I actually didn't tell a lot of people when I was waiting for that call when they found a recipient. I did tell people when the surgery was scheduled and it was actually going to happen. But the biggest thing that I was surprised about was people's reactions. So a lot of people, of course, were amazed, were surprised that I was doing it, were appreciative. But then there were some people that didn't understand at all. And sometimes it was cultural differences. Sometimes it was a language difference. Sometimes it was just merely a lack of education. People would say, "Oh, I didn't think you could survive with one kidney." Well, you can, and you'll do perfectly fine. And so I took that as an opportunity to educate them. Looking back this short time, again, less than 6 months, the best part about donating my kidney has been donating my kidney. Everything was the best part. The excitement of being able to donate one, the excitement of the hospital finding a recipient, the excitement of going through the surgery and then finding out it was a success and your recipient's doing great. That's, looking back, it's all been a wonderful experience. I would not have traded it for anything, and if I had another kidney, I would do it again in a heartbeat, easily. My advice to anyone considering becoming a living donor is just to be at peace with your decision, to make sure that no matter what outcome happens after you donate, you're okay with that decision. It is not guaranteed that your kidney will work in the recipient or that they will be successful. It's not guaranteed that they may not need a kidney further down the road. So you need to be at peace with that and understand that any outcome is okay with you. My parting words are, I would do this experience again in a heartbeat if I could. It truly was a life-changing experience. If you have any questions, concerns, reach out to other living donors, reach out to kidney recipients, get your research, learn, and ask a whole different array of people how their recovery was, what they went through, what it feels like. Do they still keep in touch with their recipient? Some do, some don't. Some are best friends, some are not, and that's okay. But just reach out, get a large range of stories and information from your medical professionals, and just know that your story will be your story. It's going to be unique and unlike anyone else's, and you will definitely appreciate it and be grateful for it the rest of your life.